So how to manage a USMLE question on Zenker diverticulum, right? So you pretty much will see a case of a 60-plus-year-old male with halitosis, as we discussed, dysphagia, food regurgitation, and neck mass. And the buzzwords you have to remember besides of these words here are upper esophageal sphincter, which is the cricopharyngeal muscle, right? It is kind of a too much contracted. Killian's triangle is the point, the spot of fragility right upper, right above the upper esophageal sphincter. It is a false diverticulum, and the USMLE steps wants you to know that just mucosa and submucosa is included. So it's fragile and it can rupture, right? This food regurgitation is undigested, so it's disgusting, and this neck mass can be described as a gurgling neck mass, right? And if we have a case of Zenker diverticulum, what would be a very decent options to mark and get the question right for USMLE step 1 and 2? We know that for USMLE step 1, we gotta know the why, right? So the physiopathology or anatomy. And for step 2 CK, we wanna know the next step when manage these patients, right? What is the next step? And what are the risks as well? So for step 1, we might as well see an answer for Zenker diverticulum case, that is dysfunction of upper esophageal sphincter, for example, or overcontraction of cricopharyngeal muscle, for example. The answer could be posterior herniation, testing whether you know it's in the posterior wall of the esophagus. And this herniation is a herniation of mucosa and submucosa. So herniation of mucosa and submucosa could also be a possible answer for a Zenker diverticulum case. For step 2 CK, you gotta know the risks, risk of aspiration pneumonia, or ulceration and bleeding, or even compression, for example, tracheal compression. And the next step to diagnose it is not an EGD because of the risk of perforation. So it's an barium swallow, barium esophagogram first. And to treat it, regardless of the way you choose to treat it, either endoscopically or with open surgery, the buzzword you want to remember for step 2 CK in terms of treatment is myotomy, or cricopharyngeal myotomy, to relieve, the obstruction of the esophagus. You also should do the resection of the pouch, so take the diverticulum out, but the buzzword for you and most important is myotomy or cricopharyngeal myotomy.